Hey everyone, welcome to your lesson on schizophrenia and other abnormal disorders. We're going to start off with a quote. The regulator that funnels certain information to you and filters out other information suddenly shuts off. Immediately, every sight, every sound, every smell coming at you carries equal weight. Every thought, feeling, memory, and idea presents itself to you with an equally strong and demanding intensity. What is schizophrenia? It is a disorder characterized by delusions, hallucinations, disorganized speech, and/or diminished, inappropriate emotional expression. During their most severe periods, people with schizophrenia live in a private inner world, preoccupied with the strange ideas and images that haunt them. The word itself means split, schizo, mind, phrenia. It refers not to a multiple personality split, but rather to the mind's split from reality. What are some positive and negative symptoms of schizophrenia? Positive symptoms are those that may experience hallucinations, talk in disorganized and diluted ways, and exhibit inappropriate laughter, tears, or rage. Those with negative symptoms may exhibit an absence of emotion in their voices, expressionless faces, or unmoving, mute, and rigid bodies. It's important to note that when psychologists refer to positive and negative schizophrenia symptoms, the terms positive and negative in this case don't mean good and bad. Symptoms are positive and negative in a mathematical sense, adding or subtracting behaviors. In the case of schizophrenia, positive symptoms are inappropriate behaviors that are present, and negative symptoms are appropriate behaviors that are not present. What is hallucination? False sensory memories or perceptions such as seeing something in the absence of an external visual stimulus. People with schizophrenia sometimes have hallucinations. They see, feel, taste, or smell things that exist only in their minds. The auditory hallucinations tend to be voices which sometimes make insulting remarks or give orders. For instance, the voices may tell the person that she is bad or that she must burn herself with a cigarette lighter. What is a delusion? A false belief, often a persecution of grandeur that may accompany psychotic disorders. People with schizophrenia also have disorganized, fragmented thinking, often distorted by false beliefs called delusions. If they have paranoid tendencies, they may believe they are being threatened or pursued. How might selective attention be a factor in schizophrenia? One cause of disorganized thinking may be a breakdown in selective attention. Recall from earlier that we normally have a remarkable capacity to give our undivided attention to one set of sensory stimuli while filtering out others. People with schizophrenia are easily distracted by tiny unrelated stimuli such as the grooves on a brick or tones in a voice. Consider the case of Maxine. Maxine, a young woman with schizophrenia, believed she was Mary Poppins. Communicating with Maxine was difficult because her thoughts spilled out in no logical order. Her biographer, Susan Sheehan, observed her saying aloud to no one in particular, "This morning, when I was at Hillside Hospital, I was making a movie. I was surrounded by movie stars. Is this room painted blue to get me upset? My grandmother died 4 weeks after my 18th birthday." What is disorganized speech? Disorganized speech is a positive symptom of schizophrenia. As with Maxine in the previous slide, jumbled ideas may make no sense, even within sentences, forming what is known as a word salad. For instance, one man begged for a little more allegro in the treatment and suggested that liberationary movement with a view to the widening of the horizon will ergo extort some wit in lectures. How are emotions inappropriately expressed in schizophrenia? The expressed emotions of schizophrenia are often utterly inappropriate, split off from reality. Maxine laughed after recalling her grandmother's death. On other occasions, she cried when others laughed or became angry for no apparent reason. How are emotions diminished in schizophrenia? Some people diagnosed with schizophrenia lapse into an emotionless, flat affect state of no apparent feeling. Most people with schizophrenia have an impaired theory of mind. They have difficulty perceiving facial expressions and reading other states of mind. Unable to understand others' mental states, those with schizophrenia struggle to feel sympathy and compassion. How might motor behavior be inappropriate and disruptive? Those with schizophrenia may experience catatonia, characterized by motor behaviors ranging from a physical stupor, remaining motionless for hours, to senseless compulsive actions, such as continually rocking or rubbing an arm, to severe and dangerous agitation. What does research show about the prevalence and development of schizophrenia? This year, 1 in 100 people will join an estimated 21 million others worldwide who have schizophrenia. This disorder knows no national boundaries, and it typically strikes as young people are maturing into adulthood. Men tend to be struck earlier, more severely, and more often. What is chronic schizophrenia? So this is a form of schizophrenia in which symptoms usually appear by late adolescence or early adulthood. As people age, psychotic episodes last longer and recovery periods shorten. So social withdrawal, a negative symptom, is often found among those with chronic schizophrenia. Men whose schizophrenia develops on average 4 years earlier than women's more often exhibit negative symptoms and chronic schizophrenia. What is acute schizophrenia? This form can begin at any age, frequently occurs in response to a traumatic event. When previously well-adjusted people who develop schizophrenia rapidly following particular life stresses, they develop acute schizophrenia and recovery is likely. People with acute schizophrenia more often have positive symptoms that respond to drug therapy. How might dopamine be associated with schizophrenia? Researchers studying the brains of schizophrenia patients after death found an excess number of dopamine receptors, including a 6-fold excess for the dopamine receptor D4. So this is taking us back to Unit 2 on biological bases of behavior. So if you look at the diagram, we have the sending neuron, we have the action potential, the axon terminal, the synaptic gap, and then the little green balls are the neurotransmitters. And you see the receptor sites on the receiving neuron. So the brain of a schizophrenic patient has an excess number of those receptors for receiving dopamine. What else is known about dopamine and its relationship to schizophrenia? A hyperresponsive dopamine system may intensify brain signals in schizophrenia, creating positive symptoms such as hallucinations and paranoia. Drugs that block dopamine receptors, remember antagonists, often lessen these symptoms. Drugs that increase dopamine levels, agonists, such as amphetamines and cocaine, sometimes intensify them. How has research been conducted on schizophrenia? Psychiatrist E. Fuller Torrey has collected the brains of hundreds of those who died as young adults and suffered disorders such as schizophrenia and bipolar disorder. How are the frontal lobes associated with schizophrenia? Some people diagnosed with schizophrenia have abnormally low brain activity in the frontal lobes, areas that are involved in reasoning, planning, and solving problems. What changes occur to the ventricles and cerebral tissue in patients with schizophrenia? Many studies have also found enlarged, fluid-filled ventricles and a corresponding shrinkage and thinning of cerebral tissue. What prenatal events are associated with schizophrenia? Some scientists believe mishaps during prenatal development or delivery causes brain abnormalities in people with schizophrenia. Risk factors include low birth weight, maternal diabetes, older paternal age, and oxygen deprivation during delivery. How are prenatal viral infections associated with schizophrenia? Fetal virus infections may increase the odds that a child will develop schizophrenia. However, many women get the flu during their second trimester of pregnancy, and only 2% of them bear children who develop schizophrenia. Is there a genetic component to schizophrenia? The 1 in 100 odds of any persons being diagnosed with it become about 1 in 10 among those who have a sibling or parent with the disorder. what is the risk of developing schizophrenia? The lifetime risk of developing it varies with one's genetic relatedness to someone having this disorder. Across countries, barely more than 1 in 10 fraternal twins, but some 5 in 10 identical twins, share a schizophrenia diagnosis. So blue is the fraternal twins, and red represents the identical twins. And you can see that in all the countries, the blue, the fraternal twins, is lower than the red. So genes matter, but what about the prenatal environment? About 2/3 of identical twins also share a placenta and the blood it supplies. The other third have separate placentas. If the co-twin of an identical twin with schizophrenia shared the placenta, the chances of developing the disorder are 6 in 10. If the identical twins had separate placentas, the co-twins' chances of developing it drop to 1 in 10. Genes and viruses. Twins who share a placenta are more likely to share the same prenatal viruses. So perhaps shared germs, as well as shared genes, produce identical twin similarities. What brain changes are evident in the identical twin with schizophrenia? When twins differ, only the one afflicted with schizophrenia typically has enlarged, fluid-filled cranial cavities. The difference between the twins implies some non-genetic factor, such as a virus, is also at work. How do adoption studies inform this discussion? Adoption studies help untangle genetic, nature, and environmental nurture influences. Children adopted by someone who develops schizophrenia do not catch the disorder. Rather, adopted children have an elevated risk if a biological parent is diagnosed with schizophrenia. Genes matter. Genes matter, but environment does as well. Schizophrenia is a group of disorders influenced by many genes, each with very small effects. And, as so often seen, nature and nurture interact. What's the relationship between smoking and schizophrenia? Most people with schizophrenia smoke. Smoking increases vulnerability to schizophrenia and contributes to people with schizophrenia having a 14.5-year, shorter than average life expectancy. How do epigenetic factors impact the development of schizophrenia? So remember that epigenetic factors influence whether or not genes will be expressed. Environmental factors such as viral infections, nutritional deprivation, and maternal stress can turn on the genes that put some at higher risk for developing it. Heredity, nature, and life experiences nurture work together. What are some early warning signs of schizophrenia? Hoping to identify environmental triggers of schizophrenia, and researchers have compared the experiences of high-risk children, for example, those with relatives with schizophrenia, and low-risk children. In one 2.5-year study that followed 163 teens and early 20s adults who had 2 relatives with it, the 20% of participants who developed it showed social withdrawal or other abnormal behavior before the onset of the disorder. What additional warning signs may be present? Researchers identified other possible early warning signs, including a mother whose schizophrenia was severe and long-lasting, birth complications, separation from parents, short attention span and poor muscle coordination, disruptive or withdrawn behavior, emotional unpredictability, poor peer relations and solo play, and childhood physical, sexual, or emotional abuse. What is a somatic symptom disorder? So moving into the second part of our lesson. This is a psychological disorder in which the symptoms take a somatic, remember soma means body, a somatic bodily form without apparent physical cause, formerly called somatoform disorder. One person may have a variety of complaints: vomiting, dizziness, blurred vision, difficulty in swallowing. Another may experience severe and prolonged pain. What is a conversion disorder? This is a disorder in which a person experiences a very specific physical symptom that is not compatible with recognized medical or neurological conditions, also called functional neurological symptom disorder. A patient with a conversion disorder might, for example, lose sensation in a way that makes no neurological sense, Other conversion disorder symptoms might be unexplained paralysis, blindness, or an inability to swallow. What is illness anxiety disorder? This is a disorder in which a person interprets normal physical sensations as symptoms of a disease, formerly called hypochondriasis. In this relatively common disorder, people interpret normal sensations, a stomach cramp today, a headache tomorrow, as symptoms of a dreaded disease. Sympathy or temporary relief from everyday demands may reinforce such complaints. What are dissociative disorders? These are controversial, rare disorders in which conscious awareness becomes separated or dissociated from previous memories, thoughts, and feelings. The result may be a fugue state, not knowing who you are, perhaps accompanied by travel or relocation to a new place. A sudden loss of memory or change in identity, often in response to an overwhelmingly stressful situation. What is dissociative identity disorder, DID? This is a rare dissociative disorder in which a person exhibits two or more distinct and alternating personalities. This was formerly called multiple personality disorder. The disease is characterized by two or more distinct identities, each with its own voice and mannerisms, seem to control a person's behavior at different times. Thus, the person may be prim and proper one moment, loud and flirtatious the next. Typically, the original personality denies any awareness of the others. Could DID be an extension of our normal capacity for personality shifts? Psychologist Nicholas Spanos asked college students to pretend they were accused murderers being examined by a psychiatrist. Under hypnosis, most spontaneously expressed a second personality. Perhaps dissociative identities are simply a more extreme version of the varied selves we normally present, as when we display a goofy, loud self while hanging out with friends and a subdued, respectful self around grandparents. How has the increase in diagnosis caused doubt about the disorder? Skeptics also find it suspicious that the disorder has such a short and localized history. Between 1930 and 1960, the number of North American DID diagnoses averaged 2 per decade. By the 1980s, when the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, the DSM, contained the first formal code for this disorder, the number had exploded to more than 20,000. Who was Sybil? Shirley Mason was a psychiatric patient diagnosed with dissociative identity disorder, DID. Her life formed the basis of the best-selling book Sybil and of 2 movies. How did media depictions drive the diagnosis fad? Some argue that the book and movie's popularity fueled the dramatic rise in the diagnosis of DID. Skeptics wonder whether Mason actually had the disorder. Media portrayals. Joanne Woodward won an Academy Award for her 1958 portrayal of Chris Sizemore, a woman diagnosed with DID in The 3 Faces of Eve. What research supports the diagnosis of dissociative identity disorder? Researchers cite findings of distinct body and brain states associated with different personalities. Abnormal brain anatomy and activity can also accompany DID. Brain scans show shrinkage in the areas that aid memory and detection of threat. Heightened activity appears in brain areas associated with the control and inhibition of traumatic memories. How do the psychodynamic and learning perspectives view DID? Both the psychodynamic and learning perspectives have interpreted DID symptoms as ways of coping with anxiety. Some psychodynamic theorists see DID symptoms as defenses against the anxiety caused by the eruption of unacceptable impulses. In this view, a second personality enables the discharge of forbidden impulses. Learning theorists see dissociative disorders as behaviors reinforced by anxiety reduction. What are personality disorders? Inflexible and enduring behavior patterns that impair social functioning. The inflexible and enduring behavior patterns of personality disorders interfere with social functioning, and the 10 disorders in the DSM-5 tend to form 3 clusters characterized by anxiety, eccentric eccentric behavior, or dramatic and impulsive behavior. The three clusters further explained anxiety, such as a fearful sensitivity to rejection that predisposes the withdrawn avoidant personality disorder. Eccentric or odd, such as the emotionless disengagement of schizotypal personality disorder, or the dramatic or impulsive, such as the attention-getting borderline personality disorder, the self-focused narcissistic personality disorder, the callous and often dangerous antisocial personality disorder. What is antisocial personality disorder? This is a disorder in which a person, usually a man, exhibits a lack of conscience for wrongdoing, even toward friends and family members, may be aggressive and ruthless, or a clever con artist. People with antisocial personality disorder can display symptoms by age 8. Their lack of conscience becomes plain before age 15, as they begin to lie, steal, fight, or display unrestrained sexual behavior. Is there a correlation between emotional intelligence and antisocial? People with antisocial personality disorder, sometimes called sociopaths or psychopaths, may show lower emotional intelligence, the ability to understand, manage, and perceive emotions. What's a characteristic of antisocial personality disorder? Dennis Rader, known as the BTK killer in Kansas, was convicted in 2005 of killing 10 people over a 30-year span. Rader exhibited the extreme lack of conscience that marks antisocial personality disorder. Do all criminals have antisocial personality disorder? Despite their remorseless and sometimes criminal behavior, criminality is not an essential component of antisocial behavior. Many criminals do not fit the description of antisocial personality disorder. They're not impulsive, and they care for family and friends. What were the results? In both stressful and non-stressful situations, those who would later be convicted of a crime as 18 to 26-year-olds showed relatively low arousal. What are genetic factors in antisocial personality disorder? The genetic vulnerability of people with antisocial and unemotional tendencies appears as low arousal in response to threats. Awaiting aversive events such as electric shocks or loud noises, they show little autonomic nervous system arousal. Other studies have found that preschool boys who later become aggressive or antisocial adolescents tended to be impulsive, uninhibited, unconcerned with social rewards, and low in anxiety. Is activity in the frontal lobes a factor? Researchers have found reduced activation in a murderer's frontal lobes. This brain area, shown at the right, helps break impulsive, aggressive behavior. What is anorexia nervosa? This is a feeding and eating disorder in which a person, usually an adolescent female, maintains a starvation diet despite being significantly underweight, sometimes accompanied by excessive exercise. Anorexia nervosa typically begins as a weight loss diet. People with anorexia drop significantly below normal weight, yet they feel fat, fear being fat, diet obsessively, and sometimes exercise excessively. About half of those with anorexia display a binge purge depression cycle. Twins Maria and Katie Campbell have anorexia nervosa. As children, they competed to see who could be thinner. Now, says Maria, her anorexia nervosa is like a ball and chain around my ankle that I can't throw off. How does distorted perception impact feeding and eating disorders? Women who view real and doctored images of unnaturally thin models and celebrities often feel ashamed, depressed, and dissatisfied with their own bodies, the very attitudes that predispose eating disorders. What is bulimia nervosa? This is a feeding and eating disorder in which a person's binge eating, usually of high-calorie foods, is followed by inappropriate weight loss promoting behavior such as vomiting, laxative use, fasting, or excessive exercise. Bulimia nervosa, unlike anorexia nervosa, is marked by weight fluctuations within or above normal ranges, making the condition easier to hide. Bulimia may also be triggered by a weight loss diet broken by gorging on forbidden foods. What is binge eating disorder? A feeding and eating disorder characterized by significant binge eating episodes followed by distress, disgust, or guilt, but without the compensatory behavior, purging, fasting, or excessive exercise that marks bulimia nervosa. A U.S. National Institute of Mental Health funded study reported that at some point during their lifetime, 0.6% of Americans met the criteria for anorexia, 1% for bulimia, and 2.8% for binge eating disorder. What research has been conducted on the impact of modeling? Researchers tested whether modeling of thinness impacted anorexia by giving some adolescent girls, but not others, a 15-month subscription to an American teen fashion magazine. What were the results? Compared with those who had not received the magazine, vulnerable girls, defined as those who were already dissatisfied, idealizing thinness, and lacking social support, exhibited increased body dissatisfaction and eating disorder tendencies.